you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there was so many perverse incentives. And these are model studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services.
And welcome back to Square Off. Health and Human Services Secretary Robert F. Kennedy Jr. endured a grilling by Senate Democrats and Republicans. His conflicting views on the COVID-19 vaccine and outright hostility to vaccines in general were on full display. Now, President Trump said he didn't watch the hearing, but is, quote, confident that Kennedy means very well. Kennedy's anti-vaccine views are already affecting the health of Arizonans. Joining us now is Will Humble, Executive Director of the Arizona Public Health Association and former Public Health Director for the state of Arizona. Welcome back to Square Off.
Good morning. Thanks.
Want to give you credit. 8 months ago when we talked about this, you called it. This is what Bobby Kennedy's going to do.
Yep, and he's in the process of doing it. He's prepared the field by replacing the Advisory Committee for Immunization Practices, and they're going to meet in a couple weeks. Maybe we'll
get to that in a minute. Did you watch the hearing?
Just snippets of it, like what you
takeaways.
Well, I can't. Not enough takeaways. I didn't watch enough to have.
Okay, won't press you for the review. I do want to ask, in fairness to Bobby Kennedy, do you see any merit in the vaccine policies, ideas he's put forth?
Not on the vaccine side of things. I think he's on the right track for some of the stuff around chronic disease, physical activity, nutrition, additives in food. There's some real merit to that part of what he believes and wants to accomplish. But this stuff that he's doing with vaccine is so far off target and not evidence-based and not helpful in any way, shape, or form. And honestly, I think he's jeopardizing his long-term ability over the next 3.5 years to accomplish some of those other chronic disease stuff by irritating and irritating the medical and public health community and then undermining people's ability to get vaccines. That's jeopardizing that other stuff that he wants to accomplish, I think.
So the vaccine issue at the moment here in Arizona and around the country regards the COVID-19 vaccines. Viewers are asking us, why aren't pharmacies like CVS and Walgreens giving it out? We hear a major hospital network is even holding back. Why is that happening?
My guess is because it's totally unknown what this advisory committee is going to do. It's meeting on the 18th and 19th in Atlanta, and they could do everything from require seniors to get a prescription before they get the vaccine to making it a lot more available. And so if you're a pharmacy chain and you're looking to order vaccine that you have to pay for, you need to know what the environment is going to be once. For example, will your pharmacist even be able to administer the vaccine? That is also at risk. So I think it's a smart move if you're a pharmacy to hold back your decision for 2.5 weeks so you don't get stuck with a bunch of stuff you can't administer.
So that's the risk to them, a bunch of inventory in the back room.
Right.
Well,
that's a reason to make that decision.
While others are risking.
Well, and also the other thing is the vaccine is, it's being manufactured now. It will be manufactured over the next few months. So this is the very beginning of the season.
I do want to remind folks who I don't think have forgotten that Arizona had one of the highest COVID death rates in the country. The highest.
And the 6th highest in the world.
Okay, which Bobby Kennedy doesn't seem to acknowledge. Let's go back to this meeting you've touched on a few times. Very important meeting coming up. Who is meeting? What do they do? What are the dates?
So it's the Advisory Committee for Immunization Practices. Kennedy fired all of the previous folks on that committee, which were academics and experts, and put in place people that are anti-vaccine and in some cases like TikTok wellness influencers. So that's who's on the
TikTok wellness influencers.
That's
super.
Okay.
Yeah.
So that's who's going to be making these decisions on the 18th and 19th about COVID-19, hepatitis B, RSV, and MMRV.
Childhood vaccine,
So
measles.
they're covering all those in a 2-day meeting. Now, the reason that committee is so important is because what because of the Affordable Care Act, what health plans need to cover, including Medicare, Medicaid, and private health insurance plans, is tied to what those ACIP recommendations are. So being able to get the vaccine is different from getting your health plan to pay for it. It also ties into who can administer the vaccine. So pharmacists in Arizona can only administer to the vaccine to people who fit into an ACIP recommended cohort. So it affects both who's going to pay for it, and will your health plan pay for it, and who can even administer it. So this is a super important meeting with respect to not just COVID-19 access, but a lot of other vaccines, and that's in a couple of weeks.
A couple of weeks, September 18th and 19th.
Correct.
Wow. And Bobby Kennedy he fired the entire ACIP board.
And put his people in there. So it's like the old thing Lincoln used to say, if you give me a day to cut down a cherry tree, I'm going to spend 7 sharpening the axe. I mean, that's getting rid of ACIP so that he can then move against vaccines. I think it's foolish because he's going to jeopardize his ability to do that other stuff, which does have some merit.
And maybe jeopardize our health.
Well, of course.
Not to mention. Yeah. All right, got to end it there. Will Humble, great insight. Thanks so much for joining us.
My pleasure.